responsible physician and medical doctor with about 22 years of experience as a clinician, expert in women and reproductive health, and a pioneer in telehealth. Welcome, Dr. Archana at India.com, and today we'll be discussing about COVID and COVID-related things due to pregnancy, because we've heard a lot of things around pregnancy and COVID. So today Dr. Archana would be answering some of the questions and clearing all the myths around it.
Thanks a lot, Toshi. Thanks for having me. And it's such a pleasure that in these troubled times, we are able to impart knowledge to people who have really no access to it.
Right, doctor. So my first question to you would be that, if someone is planning a pregnancy, is it advisable to postpone the pregnancy or not during the COVID pandemic?
Yeah, Toshi, actually, there is still a lot we don't know about the COVID-19 virus. And also in terms of pregnancy, we really don't have much data. And planning a pregnancy, I say, is a very personal choice. But at the same time, if we see medically, then what happens during pregnancy is that any normal pregnancy, the immune system is altered. The immune response of the body of a pregnant woman to any kind of virus, be it coronavirus, be it SARS virus or Zika virus, everything changes, alters. So as a result, what we have seen that there are more chances of a woman who's pregnant having COVID-related complications as compared to a non-pregnant woman. But yes, the data still is very limited. At the same time, I would emphasize is that the coronavirus does not have any defects in the fetus as in case of Zika virus. And also there is no data which says that being pregnant and you get COVID positive infection. So while pregnancy, if you get COVID positive infection, there are increased chances of miscarriage.
Right. So COVID related complications cannot be averted. So, people have to take a decision based during these times which we are seeing. Right. So, ma'am, my next question to you would be that, suppose a woman is pregnant. So is it safe to her? Because, a pregnant woman has to go for a lot of doctor visits and all of that. So is it safe for her to, visit the doctor for regular checkups, for advice or something? So in that case, what should the pregnant woman do?
Very correctly asked, because this is an apprehension which most of the pregnant women have. So what I would advise is that you cannot avoid all the doctor visits. Like when a woman is pregnant, we have a couple of ANC visits. We call them antenatal visits, which are planned. In the first trimester, so many appointments with the doctors is mandatory. But in the corona pandemic, we can reduce them to bare minimum, as in case of physical checkups or maybe for an ultrasound. That is very important. You cannot avoid those appointments to the doctor. What you can do, or as a advice to all the pregnant women out there, is that you can start using telehealth. Telehealth is a very good way of you to stay connected with your gynecologist, with your obstetrician. You can ask small issues, small queries regarding your pregnancy and what precautions you have to take for each trimester. So remain in touch with your doctor through teleconsultation, and you must go for your visits, for your ultrasound, your physical checkups. They cannot be avoided. What I want to emphasize is a visit to the doctor at the 12th week of pregnancy, the 28th, the 28th, and 36th week of pregnancy is very important.
Right. So, ma'am, my next question to you would be around vaccination. The vaccination program in India has already initiated, and everyone above the age of 18 can get their vaccination done. So we hear a lot of things that, whether the pregnant women can take the vaccination or they cannot take the vaccination. So what do you have to say on that? That is it viable for them to take the vaccination or not?
Yeah, very correctly asked. So she actually, outside India, CDC and WHO has given the green signal for vaccination during pregnancy. But in India, as of now, the Health Ministry as well as the Medical Council of India has still not given approvals for vaccination in pregnant women. Though Foxy is trying their level best to get the approvals, and we are hoping in the next 3 to 4 weeks, we will be getting the approval to vaccinate all the pregnant women. So this is because the benefits of vaccination much outweigh the risks. So I feel once we get the green signal from the government, every woman should go for vaccination.
Right, doctor. So
That's
now
right.
the most important question that, has been lingering around, that if a pregnant woman, she tests COVID positive, so what steps and what advice she should take care, especially, in regards to her diet or the exercise or anything. So what steps she should follow if she gets positive during her pregnancy?
See, we have seen that about 90% of the people who are turning COVID positive in India, we are having very mild disease. So hopefully the pregnant women also usually are having mild cases only. So in that cases, home isolation is the key. Remain isolated for 14 days. Do not come in contact with any other family members. Try to maintain the social distancing norms, the hand washing, but once you're interacting with the family members, they must wear masks. Also, I would emphasize here is that anxiety and depression related to COVID is very common among women, especially when they are pregnant. So in that case, one should try to remain very positive, remain focused, try to read books, keep yourself well hydrated, have a good balanced diet full of green vegetables and fresh fruits, listen to music, meditate, do light yoga exercises. Even when you are in isolation, you must have a normal routine. A normal routine is very important for good mental wellness. So even if you're confined into your room, have a normal routine, have an exercise pattern, have well balanced diet, and keep your spirits up. And most important, take care of your SpO2 levels, temperature monitoring, be in touch with your doctor as well as your gynecologist, both doctors, the doctor who is treating you for COVID, as well as your gynecologist, because there are certain drugs which cannot be given in pregnancy, especially doxycycline, ivermectin, which is being given to all the population, that is not to be given for pregnant women. Otherwise, continue having your multivitamins, your calcium tablets, which are prescribed by our obstetrician.
Right. So, ma'am, because pregnancy is a thing which involves the husband and the wife both. So, what responsibilities should the husband take or other family members if they are with the pregnant woman when the lady is pregnant, especially in these COVID pandemic times?
That's very important. Like I said, first of all, we have seen a rise in depression and anxiety of in pregnant women during this COVID time. And also, we have noticed an increase in domestic violence because of lockdown scenario and there being a pandemic. The couples are more confined to their homes, and there have been increasing cases of domestic violence. So this is something which really needs to be, taken care of by the immediate family, that such kind of circumstances do not happen. Also, I would also emphasize that if the husband or the family members are going out for their work related needs, then in that case, when they come, they must not immediately go and meet the pregnant woman, because she is always at a risk of catching the infection. And they should first, if they're wearing clothes from outside, they should go for a bath, they should segregate the clothes away. And also, if they are regularly going out of the house for their needs, the husband should try to wear a mask, and the other family members should also try to wear a mask at home too, to protect the pregnant woman.
Right, doctor. Thank you so much for interacting with us and hearing all the doubts around COVID-19 and pregnancy. It was a pleasure to have you on India.com and the health site.